Hello and welcome to another short video on the psych or mental health nursing. Okay, today we're going to be talking about anxiety and anxiety disorders. So the definition of anxiety is a universal human experience that is considered the most basic of human emotions. You do have levels of anxiety. Mild anxiety, we all face mild anxiety as we go through life. It occurs in normal experience of everyday life and promotes a sharp focus on reality. Moderate anxiety, it narrows the perceptual field and some details become excluded. And severe anxiety, it narrows the perceptual field also, and the right amount of focus on detail is lost. Panic, the extreme level of anxiety. When you get to the panic stage of anxiety, it's not only affect your psychological being, it starts affecting your physiological being. Okay? So it leaves the person unable to process the environment. So please to go over the levels of anxiety. Okay? Let's talk about defense mechanisms that we all utilize. We use defense mechanism to get through certain emotions or issues that we are having. So let's start with denial. Denial is a defense mechanism that we all use at times. Okay, we cannot believe what is happening in our lives, so we tend to go into denial. Another defense mechanism is displacement. You may be angry with someone, however, you're afraid to tell that person that what they did has hurt your feelings. However, you would start taking it out on others. Okay? Another defense mechanism that you should pay much attention is projection. Unconscious rejection of emotionally unacceptable features and attributing them to others. That's projection. Regression is another defense mechanism, like reverting to an earlier developmental levels. Sublimation. What is sublimation? Is directing unacceptable behaviors into a socially acceptable area. This is always adaptive. For example, a student who is angry with a faculty member writes a short story of a hero. That is sublimation. So please to go over defense mechanisms that you may encounter on your State Board of Nursing: denial, projection, regression, sublimation. Those are popular ones that you may encounter on your State Board of Nursing. Thanks for watching this short video on anxiety and anxiety disorders, how to cope with anxiety. I will see you in another video. Please like, share, and subscribe to the channel to help it grow.